and good morning to you.
Good morning to you. Good morning to your cherished listeners and viewers.
I hope you're well.
I'm doing very well. I'm with a shocking presentation of Dr. Bawumia'S about the health sector today. Trying to reconcile with what we know. Yeah, but I'm fine.
The key issue, of course, when it comes to Dr. Bawumia'S, his direct contribution, and it was something that he talked about and shared a story about his father's own challenges when he was sent to the Tamale Hospital, and then the challenges with trying to get him blood, among others, that inspired his decision to bring drones into the country to fly blood to some parts of the country. That's his major contribution when it comes to healthcare, where we can see his direct hand in it. He speaks so highly of that. What do you make of that as somebody who have worked in this field for so long? Is it as big a deal as he made it look?
In fact, the issues of introducing drone service in the chain, we criticize it because we did some cost analysis. It might do something, but what it's not worth it. The thought of flying blood from one place to the other, flying emergency medicine, we explain that emergency medicines are needed as and when the patient is sick. You don't need to spend 30 minutes to get an emergency medicine, or even 5 minutes. You need it at that moment. And that there are protocols laid down at the various hospitals on how emergency drugs must be stocked. And the Ghana Health Service goes around to inspect hospitals, inspecting emergency drugs, whether they are available at the emergency point or not. They talk of preventing women from dying and sending blood to cheap compounds to save lives. And we told them that cheap compounds do not transfuse blood. Community health nurses do not treat heart failure. What we needed to do was rather to resource all the hospitals well by distributing the resources to them, giving them their money to equip themselves and resource themselves with what they need. As I speak to you today, ask Dr. Bawumia'S, how many people from Walwale come to Tamale Teaching Hospital for medical care? They are increasing in number, even though he has a drone center sitting there and people are paid. Once in a while, they take a drug to one hospital and paying people heavily. The cost that the money that we spend maintaining those centers is too much for what they do. That is what we criticize. But yesterday, he came to tell us that the opposition cried that was going to use a drone to snap women pictures when they are bathing. I think that was too below the belt for somebody sitting. He will not get it to be. Simply because the information is being fed with are crap. And one good example that yesterday that made me to believe that he's fed wrongly, he's being given wrong information. Just like our current president was fed wrongly about CBS. And he has to cancel it. Bawumia'S is being fed wrongly with wrong information. How does a vice president who wants to be president, who has talked about digitalization in this country, tell us that he has already interconnected 302 hospitals in Ghana by digitizing them? And that a doctor can sit in his hospital and access the folder of a patient from another hospital. This is one of the things that blew my head. And that is going to prevent patients carrying folders from one hospital to another. Let me tell Dr. Bawumia'S and those advising him and feeding him that per the laws, no patient is allowed to hold his folder out of the hospital, any hospital. Not to talk about holding it from one hospital to another. So it means he's wrongly informed. So if he was going to develop any project or any policy, in the first place, he's got it wrong. He's got it wrong. And to say that you have networked 302 hospitals, all teaching hospitals, all regional hospitals, and all district hospitals have been interconnected. And now doctors are assessed patients for older sitting in one hospital and reviewing a folder in another. That one, I beg you, Dr. Bawumia'S, you are being labeled a liar, and this is one of the biggest lies you have ever told about the health access your folder at the surgical ward if they need it. But you can't access a folder in Tamale Teaching Hospital if you are sitting in Kolebu or if you are sitting in Legon. So I don't know where Dr. Bawumia got this information. And I think that they shouldn't take it for a ride by trying to spew out what is non-existent to accredit himself as a champion of digitalization. If you've done it, we'll applaud for you. But if you haven't done it, please, it is not. Before I left Rich Hospital, we had introduced project, the 10-kit project. Private hospitals already had introduced electronic medical folders. It is not Bawumia who has introduced it in Ghana. It is not Bawumia. It was already in existence. It's just the government is rolling it out, and we rolled it out in Rich Hospital. And hospitals were rolling it out in Legon Hospital, in Kolebu Teaching Hospital, 37 Hospital. They were being rolled out. It is not Bawumia who has come to introduce it. And to say that you have interconnected all regional hospitals, teaching hospitals, and district hospitals, I beg him, it's a lie. He should call all those who gave him that information to book, or else they will mislead him the more.
You are saying the suggestion that if you're sitting in your hospital today, you can see the folder of somebody as Kolebu. It's not true.
It's not true. He mentioned it categorically that 302 hospitals have been interconnected. That all regional hospitals, all district hospitals, and all teaching hospitals have been interconnected into one hub that you can access the folders, and patients don't have to move with their folders from these 302 hospitals to one hospital to the other to see a doctor, which is a palpable lie, a very categorical, fat, big lie about Dr. Bawumia. And I bet you can place a call right now. Let your agents go to Kolebu Teaching Hospital and ask them whether they can make a complaint, view a patient's folder in Rich Hospital. They can't do it. There must be a policy, and there must be what we call a data protection must come in with some laws to see how you can sit in another hospital and look at another to avoid people's information being leaked.
I love Radio Gold 90.4.
Say people have developed electronic medical records in their hospitals, and you say you have interlinked them like mobile money operability. It is not working in the health sector. That thing is not yet out. You can call the GMA chairman, Ghana Medical Association president, and ask him whether it is true. You can call the CEO of Kolebu and ask him whether what we say is a lie. What I don't want in the health sector, I normally stand against lies in the health sector. Another part lie he told is that they have employed 100,000 workers in the health sector since they came to office. Please, when Mahama was leading, we had 96,000 health workers. They came in 2020 to tell a lie that they have increased it to 126,000, and we proved them wrong. Let's go to Smith and go to Ghana Health Service and ask them how many workers they have currently. Is he trying to tell us that they have employed, we currently have 200 and something thousand health workers in Ghana? That is not true. His issues about figures in the health sector is not correct. As of now, we don't have up to 140,000 health workers in Ghana. So where are the 100,000 he employed in addition to the 120,000 that they had in 2020? How many of them have retired? And where are the rest of the people? This is what they do, and we think they put in cook figures from ghost names and pay people money that are non-existent. So Bawumia should give us the breakdown of all the health workers that he has employed in the past 7 years. Let's compare it with what is at Smith. The government is paying health workers at Smith. How many of them are there? Then you see that what he told us is a palpable lie. They have not employed 100,000 workers. Health workers are running, leaving this country. Nurses alone in 1 year, 4,000 something nurses left this country because they don't like the work. So these are the 3 points I think that Bawumia should come again. What I didn't hear him talk about is how they manage COVID-19 and all the money. He kept silent on that. He should have told us that they will not allow any minister again to defraud the country like our minister did. He didn't talk about that corruption. How you pay for vaccines that were non-existent. He didn't talk about that. He's rather talking on things that really do not exist. And I think I wasn't happy about his submissions about the health sector.